So very warm greetings and welcome to you all. And we're just going to begin with the karakia. Yes. Whakataka te hau ki te uru, whakataka te hau ki te tonga, kia mā kina kina, ki uta, kia mā taratara ki tai, I hiaki ana te atakura, he tio, he hoka, he hauheu, haumie, hui, taiki. So I'm Helen Willacy, the President of TSC New Zealand, and very excited to be hosting our very first TSC conference in New Zealand. And I'm just going to pass over to Clare from Australia for a few words.
Thanks everyone, it's so exciting that this weekend's actually happening. I'm Clare Stuart, I work for Tuberous Sclerosis Australia, which up until this year was the Australasian Tuberous Sclerosis Society. I'm the older sister of Elizabeth Pinkerton, who had tuberous sclerosis and also polycystic kidney disease. Tuberous Sclerosis Australia is a very small but growing organisation, first established in 1981. Since then, we've provided peer support, information, research funding and advocacy to and on behalf of families living throughout Australia and New Zealand. Our major goal for the last 3 years has been to improve our connection with families living outside of New South Wales. This year, our focus has been on New Zealand, and it's been a pleasure working with Helen, Janet, Leah, and others to make this weekend and TSC New Zealand a reality. Some people ask me, why a conference? In this age of ready information on the internet, what role does a face-to-face conference have? Historically, conferences and other education events were the only way to get balanced and up-to-date information about a rare and complex condition like tuberous sclerosis. Conferences were unique opportunities to ask questions and also to connect with others that were struggling with similar challenges that life with tuberous sclerosis invariably brings. I strongly believe that conferences still have a large role to play in both these areas, both in information and in peer support, but also in strengthening our grassroots organisations. For the speakers this weekend, these events are ways to build their interest, expertise and commitment to tuberous sclerosis. I heard David Moet recently attribute his opening of the TSC clinic in Sydney to the persistence of Sue Pinkerton, past president of ATSS, at each annual seminar day in Sydney. We have seen a similar pattern more recently in both Perth and Brisbane in Australia. My hope is that the generous health professionals who have given up their weekends to speak with you all will deepen their understanding of the unmet needs of individuals with tuberous sclerosis, and together we can develop solutions in New Zealand to these problems. This weekend also provides an opportunity to strengthen the connections between the members of our community and for us to hear from families living with tuberous sclerosis to ensure that we understand their experiences and their needs. And so for New Zealand, where we've not been active very much in the past, we believe that this conference weekend will provide a launch pad for future work that will have a wider impact throughout New Zealand. For most of you, this will be your first tuberous sclerosis conference. I've already spoken to a number of you this morning where today is the first time you've ever met anyone else with tuberous sclerosis. I know that this can be an incredibly daunting prospect, and I want to assure you that our volunteers from Tuberous Sclerosis Complex New Zealand, but also Kate and I from Tuberous Sclerosis Australia are here if you need someone to have a chat to in the breaks or otherwise. There are boxes of tissues around. Totally expect them to be used. I usually have a cry at some point, so please feel free. If it all gets too much, take some time out. The majority of people who come to our conferences tell us that these events are both informative and supportive. Many tell us that they wish they'd come to something sooner. My hope for you all is that you leave this weekend feeling a similar way. I'd also like to acknowledge that coming to an event like this can be logistically difficult. I'd like to acknowledge the carers, family and friends that have allowed you to be here today.
I just want to say talofa lava and good morning, ladies and gentlemen. It's a real pleasure to be here with you, supporting particularly those that live with tuberous sclerosis. I should call it TSC. I'll call it TSC, or I'm going to start tripping over myself. and your families, your caregivers, the medical professionals that are here. But it's just neat to be here. When I first arrived downstairs, because we go to medical conferences a lot, and you expect a whole lot of medical professionals, and you don't expect so many families and friends at these conferences. So when I saw Brianna, I thought to myself, she's pretty young to be a professor. I said, oh, so how are you going? She said, no, I'm going really well. And I said, so how are you involved? And she said, oh, I've got TSC. And I said, oh, okay. I've just left school, she said. I thought, oh, okay, that's great. Because I thought she was so young to be, one of the medical professionals that you expect at these conferences. But thank you for escorting me up here. And Helen had actually emailed me, was it about a month ago, Helen? Yeah, and she was in my electorate, believe it or not. She and Tam and Mac and the family. And I said, yeah, no, I remember you guys. And I've been delegated the health portfolios just earlier this week. So believe it or not, this is the first health event I've gone as the Associate Minister of Health. And as Helen's already said, I tell you what, waking up today being the Associate Minister of Health is sure better than waking up yesterday as the Minister of Corrections. I can tell you that much. But I didn't expect to come here and shed so many tears. And I think what she said this morning was very heartfelt. And it was the story of a family and children. And I think it's something that we can all have, an affinity with, a relationship to. About the love of mother and a wife, for her family. And I think, Helen, thank you for sharing that, because those sorts of stories, they just give this a lot more life, and it gives it real context, I think, as to what we're going to go through today. And we're going to hear from them, with respect to the medical professionals. I know you're going to come in with the technical details, but this was really, really heartfelt, certainly for me. So I just want to acknowledge, Dr. David, those that have travelled from Australia, Clare, and your team. Also, those that have travelled from around the country, because it's not easy, as already been suggested today, in terms of coming here. But it's great to see families here today. I'm here to help launch this conference, and I think, I'm not going to go over the details. You all know what this, is about, in terms of TCS, sorry. I'm going to confuse myself. But we also know that, in terms of that it can be life-threatening, and it can have, significant impact on families, on quality of life, not just those that are, like Mac and others that are suffering from the condition. And we know that it also has, it can cause epilepsy, developmental delay, autism, a whole range of, and it affects multiple organs. I think that's what's going to become clear today. So you all know that. But why is it important? And I think Claire's already touched on why these conferences are important. I think it is about sharing ideas, sharing opinions, sharing stories. But I think also it is about raising awareness. And I think Helen captured it well. If she hadn't gone to that conference in Sydney, she wouldn't have, found out about different ways of different treatments, different ways of options around treating the condition and dealing with her own story around it. So it is about raising awareness, but also we also need to focus on information. And clearly, it's our role as the government, but it's also great to see families involved in getting information out to people that need, a little bit of information, a little bit of ways of dealing with it. Also sharing. When I heard that there were some people who hadn't met someone else, had been through that, been through the experience, I think, if this conference can even bring that together, I think we're going to achieve something here today. So it's also about, I think it affects children and adults, and one of the things that we've got to look at, certainly as a government, is how we have the integration between the paediatric care and going through to adult care. And it's that sort of seamless integration of that care that needs work. I think both here in New Zealand, certainly in Australia, I know it, the integration needs to work around the world. Gosh. Really, it's incumbent on me just to wish you all well. It's the conference is, it's a pleasure to be here, and I just know that this will be the beginning of something in New Zealand that will continue, will grow, and will capture not just I think the hearts and minds of those that are affected by it, but I think we need to also spread a message out there to people who may not know about the condition, and may, from better information dissemination, better discussion around not just the medical table, but around the staff room, as we found ourselves here today. And so we can learn more, grow more, and better able to treat, particularly the kids that are affected by it. So thank you for the invitation. I want to wish you well here today. I'm going to sit and listen as well and support you in what you're trying to achieve here today. But it's an honour, and thank you very much. And all the best. All the best with what's happening here today. I'm looking forward to hearing a bit more about, and I'll keep my tissues very close by and not on the table there. Thank you very much. You show me how to do it. There you go. Yeah. Well done.